National Arthritis Awareness Month, and we want to turn the spotlight on a NASCAR Infinity Series racer who was born with juvenile rheumatoid arthritis. So Jean Song has more on Natalie Decker's journey of grit and resilience.
It was so much fun.
It was fun. Good job.
I love the speed. I love the adrenaline. I love the competition.
In the driver's seat, NASCAR racer Natalie Decker has been pushing boundaries and claiming victory since she was 9.
My dad took me into a go-kart track, and I saw kids my age racing go-karts, and I knew right then and there that I could do that, and that would be a way for me to learn more about racing and get the experience to hopefully one day race in NASCAR.
But the Wisconsin native had to factor in a bump on the track: juvenile rheumatoid arthritis.
Having to pretty much live at the doctor's office, going there every other week, getting your blood drawn, seeing all sorts of different doctors. I definitely knew at a young age that that was going to be a big part of my life.
With the right doctors and treatments, Decker was able to stay in the zone.
I was in dance class, I did plays, I played in hockey, I did so many sports, and my life was still very active.
But even today, she makes pit stops for her health a priority.
My routine for preparing for a race or recovering from a race is definitely different than a lot of other race car drivers. You have to be very athletic. It is very hard on your body. And that's one thing a lot of people don't know. We are sitting in one position for hours at a time. And that's really hard on my joints and my body. So a lot of the times my hands will flare up and I'll have a lot of pain in my hands or my elbows, my knees. Some days it's really hot, and whatever temperature it is outside, it's about 20 to 40 degrees hotter inside the race car. So it can be very tiring and exhausting. And I have to really train my body to make sure I will be able to last the whole race.
As an ambassador for the Arthritis Foundation, Decker has been more vocal about her condition in recent years.
I was so nervous to talk about the autoimmune diseases I have because it's scary to, talk about your personal life like that. And I didn't want people to see me as weak or treat me different or judge me for what I have. And I'm so glad I shared my story because there's been so many people that come up to me at the racetrack or message me on social media, and they tell me their story, and we can relate on such a great level. And that just really makes me feel really good that I can share my story and help others.
Her experiences have also taught her to look beyond the surface.
With having an autoimmune disease, I've learned that so many people are going through something that's invisible that you cannot see. So many people, when they look at me, I look healthy, I look strong. So you always treat others how you want to be treated. You have no idea what's happening behind closed doors or what their health looks like, and to always be kind.
Now, please welcome to the stage, Liz Smith.
Good afternoon, and I do hope that you're all enjoying this day. We're so very excited to have Natalie Decker here. You may have heard from your kids that she visited the teens and the kids yesterday. And as many of you know, she brought her race car with her to Orlando. If you haven't been out to see it, please do that at the break. She's a very inspirational young woman. Today, I have the pleasure of presenting the 2022 Earl Brewer Award for Physician Leadership. Established in 1989, this national award was named for the father of pediatric rheumatology. The award is presented to a physician who has made an outstanding contribution to the care of children with arthritis and rheumatic diseases and advocated on their behalf, and has demonstrated a commitment to the Arthritis Foundation through fundraising events, volunteer opportunities, and/or JA activities. It is truly an honor for me to present this year's award to Dr. Peter Chira. Dr. Chira has been involved in patient care and advocacy on a local and national level. He's been in national leadership roles on the Conference Planning Committee and the Medical Advisory Board, always offering insight to the various program tracks. His guidance on program development has shaped the conference program for parents, teens, and kids. Dr. Chira is kind-hearted and fun. When he speaks to the kids, they feel safe and they have a good time learning about the diseases that they have. I met Dr. Chira first at a conference in St. Louis in 2012, right? 2012. And right away felt that this was a physician with whom our kids would be comfortable, with whom we as parents could be comfortable. And a few years later, when another of our children was diagnosed with an autoimmune disease, I was sharing her interaction with her physician, with Dr. Chira. It was not a positive interaction with this physician, and my daughter did subsequently fire that physician. But Dr. Chira just gave such wonderful words of advice for my daughter. And when I shared them with her, she laughed, she smiled, and she was so appreciative. And those are some of the kinds of things that we really, I think, as parents come to look for and admire in the physicians who come and give of their time and talent at events like the Juvenile Arthritis Conference. So Dr. Chira and Steve, would you please join me up here on the stage? Please welcome Dr. Chira.
I want to thank the Arthritis Foundation for this award. And, everybody knows that this program and the conference is really near and dear to my heart. I also want everybody to know that, your children are near and dear to my heart, and all the work that we do with regard to transition. I really feel that the foundation has been instrumental in sort of supporting me in that work. And hopefully your children have benefited as well as you have. Thank you again for the award.
So I now have the pleasure of introducing our keynote speakers for this afternoon. Dr. Monica Friedman is Chief of Pediatric Rheumatology at the Orlando Health Arnold Palmer Hospital for Children. Dr. Friedman earned her medical degree from Nova Southeastern University College of Osteopathic Medicine, it's a mouthful, in Fort Lauderdale, Florida. She then completed her pediatric residency at the University of Florida College of Medicine in Jacksonville. From there, she continued her training in New Hyde Park, New York, completing a pediatric rheumatology fellowship at Cohen Children's Medical Center. After completing her training, she accepted a position as assistant professor at Baylor College of Medicine and worked as a pediatric rheumatologist at Texas Children's Hospital in Houston, Texas. She has co-published articles involving complicated rheumatologic disorders and edited the chapter on chronic fatigue syndrome in Rudolph's Pediatrics textbook. Although medication is the mainstay therapy for rheumatic diseases, Dr. Friedman has incorporated complementary therapies to her practice to provide an integrative approach to treatment. Dr. Monica Barreto is a pediatric psychologist with Orlando Health Arnold Palmer Hospital for Children. She's experienced in the treatment and assessment of children and adolescents with a wide range of medical and neurological conditions. Dr. Barreto provides psychological care for pediatric patients experiencing cognitive or behavioral problems as they relate to chronic illness. Dr. Barreto received a master's degree in applied developmental psychology from the University of Pittsburgh before earning another master's in psychology and her PhD in clinical psychology from Western Michigan University in Kalamazoo. She completed a pre-doctoral clinical psychology internship and postdoctoral fellowship at the Yale School of Medicine, Yale Child Study Center in Connecticut. Dr. Barreto is a member of the Society of Child and Adolescent Psychology, Society of Pediatric Psychology, and Association for Behavioral and Cognitive Therapies. She is also fluent in both English and Spanish. Dr. Barreto, unfortunately, has been battling the flu this week, so she's joining us online. Dr. Friedman has agreed to remain after the session for about 30 minutes to answer questions. Unfortunately, we don't have a way to include Dr. Barreto in that. Please join me in welcoming Dr. Monica Friedman and Dr. Monica Barreto.
Hi, Dr. Barreto.
Hello, everyone. I'm glad I'm able to join via technology today.
We're super excited to be able to present this topic to you. Dr. Barreto actually just started working with me at Orlando Health a couple months ago. How many months is it now?
Almost a year soon, about 8 or 9 months.
Goodness, time flies. And we've been able to work together so well to incorporate the emotional and physical aspects of GIA together. So I was really excited when we got to work on this talk together. So I hope you guys can enjoy. We're gonna try to be as fluid as possible since we're online and in person, but I'm gonna be moving the slides, so we'll get started.
Well, today what we'll be focusing on talking about is the connection between the mind and the body, and how does what your children and teens are going through with juvenile arthritis and other medical diagnoses, and how are they handling that, and just handling emotions, thoughts, worries, and how and when do those interconnect. So we'll talk a little bit about the medical side of things as well as the emotional and psychological side of things, and hopefully giving you as parents tools on how to better communicate and also support your teens and children throughout the different years of their development.
So this is kind of a little triangle of how we as physicians assess a patient with GIA, so a multidisciplinary approach. We as the clinicians are there to diagnose and treat with our medicines and our guidance and education. And then sometimes physical therapy and occupational therapists are involved, particularly if your patients have a lot of joint pain, persistent joint pain or contractures or gait abnormalities. We use them as very helpful tools. And there is a really important role for psychology in these patients that I think gets overlooked a lot. And hopefully throughout this talk, we'll be able to help you better understand what the role of a psychologist is and how they can help integrate into the care of your children.
A similar triangle, when we focus on the section that psychology does play in the care of your children, is what we call the cognitive triangle in cognitive behavioral therapy, or CBT for short, which is something common that families have heard in the past when thinking about therapy. If we think about the corners, thinking about we have our thoughts, our feelings, and our actions, and we see that these arrows in our triangle are going either direction, that is because they all interact with each other. How we're thinking about something impacts how we feel, which inadvertently impacts on how we act. How does that come into play when it comes to management of stress or management of stress on top of a medical diagnosis? An instance is if we're having worried thoughts, maybe that is we're going to the doctor, we're very worried and scared knowing that we're going to have to get a shot or have to get a checkup. Your child is going to have physical reactions to that. Those can be butterflies in their stomach, they can have sweaty palms, they can begin to cry. Though that worried thought is having a direct impact on how they're feeling, and we can all probably picture in our mind what that would lead to in their actions. The little ones will talk a little about how that may look in different age groups, but often that can lead to avoidance of the doctor, becoming maybe behaviorally overwhelmed, right? That is one scenario on how this can impact. Another simple one is oftentimes, even if we're feeling upset, maybe we're having negative thoughts, we're feeling more overwhelmed, maybe we're less likely to talk with our parent or tell them what we're thinking about, right? Now, when we think about how our thoughts, our feelings, and our actions interact, we can only control one of those three, and that is our actions. So throughout our presentation today, we'll talk a little bit about, as parents, how you can support your children in managing their worried thoughts, their overwhelming feelings, and making goals that they can focus on their actions. What tools they can use, what activities they can distract themselves with, what relaxation tools they can do, because as these arrows are going either direction, once we control our behavior, that can calm our worried thoughts, and it can calm the physiological symptoms that come from stress. So throughout, I'll kind of bring us back to this triangle as we talk about different scenarios in ways our thoughts, feelings, and actions interact with one another. Now, we've often have, even through our work, both myself and Dr. Friedman, oftentimes in our work, the mind and the body are separated. We go to our medical doctors, we have stomach ache, something hurts, we have a cut, and we go to a therapist, psychologist when we're feeling stressed or very overwhelmingly anxious, or feeling more depressed than usual. However, the mind and body have a very strong connection. Whatever we are, however we are feeling, if we're stressed, if we're not sleeping well, if we're experiencing a lot of pain, that all interacts with each other. Let's say if I'm having chronic pain, but I'm also stressed, I'm not sleeping, I'm not eating well, I can experience that pain more, right? Because the nerves in our body are sensors. They're sending those messages up to the brain, which are sending them down our spine and into all of the other parts of our bodies, right? So it's important to be able to manage our stress, give these tools to your children. And also, even as parents, you're also experiencing a lot of stress yourself. So hopefully we can give you some tools today. We think about pain as an example. We experience pain, let's say we stump our toe, right? That our skin is getting sensors that's shooting up the spine. Our mind is then having a response in a couple of ways. We're having physical pain, but we're also having thoughts that we're in pain, this hurts. We're also having a reaction to that. All of that is connected. What can we do? There's two parts in all of our brains that are our parasympathetic system and our sympathetic system. What that means, if we think of it like a light switch, one turns on our fight or flight, that pain, that alert, the other one calms it down. In these moments, we can learn ways to calm our body since we all have that very close connection. And pain is always a negative experience, but we can learn how to dial that back. We'll talk a little bit on how to do that. All right. Within this mind and body connection, some of the big stressors that may have us have more of a negative experience, think of it like a megaphone, is symptoms of depression and anxiety. From children to teens to adults, we've all at some point have experienced depression and anxiety. I do want to normalize that for all of us. That doesn't mean that there is anything wrong. We've all had moments where we're more nervous than usual, we're more nervous than we need to be. Even as ourselves, we're professionals, and I'm sure me and Dr. Friedman have some butterflies in our stomachs as we present to you today, and that's okay. So we'll talk a little about what are our expected signs and symptoms, right? Because we can think about depression, we often think of someone who's isolated, they're very sad, maybe crying, but that can look a little bit differently for yourselves as well as younger children versus teenagers. Some signs are sleep difficulties. If your children are sleeping a lot less, having trouble falling asleep, or are sleeping too much, that can be a sign. Maybe limited interest in hobbies, maybe what they used to really enjoy. They're not finding as much enjoyment anymore. Maybe they're more irritable than usual. They're feeling more withdrawn, more hopeless or helpless. These are all signs that your child may need some support. That may be support from yourself, or maybe some support from a therapist or a counselor. On the other side, we have anxiety, which at times they can occur together, but they may look a little bit differently. When we think of anxiety, symptoms under that umbrella are more feeling nervous or worried or scared. Those are all easy synonyms that are more common for children and teens to use to describe how they're feeling. How does it feel in their body? They may have racing heart, sweaty palms, dizziness, having trouble focusing, having trouble with organization. Sometimes this can mimic ADHD or inattention symptoms in children and teens. And also some fears that may keep them from doing things. Maybe they don't want to go to school anymore. Maybe they're having stomach aches and headaches in the morning. Maybe they're experiencing more pain before school or during school. Maybe they're trying to avoid habits that they used to do, like going out with friends or social settings. These are all signs that anxiety may be playing a bigger role in their day-to-day than expected.
So we thought that it would be a little bit more interactive and more interesting for you to do case scenarios for this presentation. We wanted to kind of go over real life scenarios that I've experienced in my practice and things that you might be curious about or worried about in your own children that you may not realize is very common in other families. So we're going to break it down into 4 different case scenarios. Toddler years, elementary school, middle school, and high school. So I just want to start off with a show of hands. How many people have toddlers in their room? Just a few. Elementary school age? Awesome. Middle school? Lots of middle schoolers. High school? Lots of high school. Excellent. So you're not alone. You saw the different hands up for each of the different scenarios. So you'll know that you have some people to talk to at the end of this if you need. Who was diagnosed in toddler years, who's now a little older? A lot of you guys, okay. So maybe you'll relate to these scenarios as we go on, and you can remember what it was like when you had your toddler and now how they are now. So this is a typical case scenario for us rheumatologists. I think Dr. Chira can relate to these as well, but this is a typical 3-year-old patient we'll have come to our office diagnosed with oligoarticular JIA, so like a single joint of arthritis maybe in the knee. And different rheumatologists treat differently. So if you feel like this wasn't the case scenario for you, that's okay. But in my practice, I do a lot of joint injections. So let's say this patient received a steroid injection and didn't have a really good response. So where are we next, right? So now we move on to the dreaded injections. How many of you love those injections, right? So our toddlers are, I have a 3-nager. I like to call her my little Maya. She's 3, and imagining the thought of injecting her with methotrexate scares the bejesus out of me. So I applaud all of you parents who have had to do this with your toddler. But those methotrexate injections are stressful, not just on the child, but on the parent as well. I think the first person who is affected the most by it is the parent, especially the one who gets forced to do the injections, which a lot of times I think is dad, but moms are really strong with them too. And it's a battle with the child. You're having to hold them down, and they're crying and screaming and kicking, and you're getting beat up, and you're feeling just terrible inside about having to stick a needle into your child every week. So, stressors are there. Initially, I think one of the big stressors that we don't always think about is sedation, right? With a steroid injection, most kids in that age group have to be sedated, and I think that's the scariest part. And I have noticed that more times than not, it's the father that drops to the floor and passes out when the sedation happens for the joint injection. But I think, unfortunately, over time you get used to it, which is not something you want to think is such a great thing, but it does get easier over time. But really, what we need to do is learn skill sets for our patients and parents, handling weekly injections, handling sedation, and kind of discuss what is normal in that age group for them that we don't need to worry that we're traumatizing our child every time we inject them. So I'm going to turn it over to Dr. Barreto, kind of talk about what is normal for a toddler to experience, what my 3-nager is experiencing right now without JIA, what is normal for her, and that when you add injections, you add a diagnosis of a chronic disease, what is okay to experience for your toddler, and what we can do to help for you guys to handle it better and for your toddler to be able to manage it better.
Yes, and I know we're talking a lot about your children, especially your toddlers, but also this is something in any medical diagnosis, as parents, you're going through it as well. You're experiencing the same anxieties and fears, and sometimes a different kind of pain. So I do want to normalize that fear, especially it is quite normal for a toddler to be the yelling, the kicking, the screaming. Sometimes that can be harsh words like I hate you to whoever is the person holding them. And that also naturally can happen in a primary care setting when they're going for their checkup or they need their flu shot. This is something that they're not imagine ourselves back at 3 years old, not understanding really what's happening, knowing that something, maybe it won't hurt as much, but just thinking a needle, right? If we all put ourselves back into that space, we would probably run out the door screaming, right? And that's okay. And that's what a small child is also experiencing in any medical situation. It's a scary environment, but it's also an unknown environment. And the unknown leads to anxiety and fear. So there is also part of the holding down, always reminding yourselves when you are holding them down or you are reminding yourself, we're doing this for a reason. We're doing this for their health. We are helping them in the moment. It may feel like you're doing the harm, but also reminding yourself in the moment, why are we doing it? Even if you need to put the things down, take a break, gather yourself, give yourself that permission as well. We don't need to rush these things, especially at home when you have that time. What are some of the things that are helpful is talking with the child, letting them know what to expect. Having them choose a place in the house where we can do this. It's in their room, sorry, at the dining room table, what activity they want to do before, what activity they want to earn after, and even working with them to expect what's going to happen before, during, and after. Giving them a little bit of control can also help. In the moment, some of the coping strategies that we can do to help bring their body down, sorry, is even playing I Spy. In that moment, looking around the room, what are 5 blue things they can find? 4 red, 3 green, 2 yellow, really bringing them back to that moment using their senses. Things they can see, they can touch, or even they can hear, can also help regulate their little bodies in those moments of distress.
So then we move on to the elementary school age child. So these are actual real case scenarios for my patients in my office. So this was a 9-year-old female newly diagnosed with polyarticular JIA, 5 or more joints, who is struggling in school. So we've had experiences where you have difficulty with writing from wrist arthritis or difficulty completing assignments, and parents having trouble with the school. We spoke with Adam, the warrior dad here, who's head of this conference, and he was telling us how frustrated he was with an experience with the district and the 504 plan for his child, and how it became a huge stressor on him, and it impacted how he was able to react with his children. So these stressors are not just the children's stressors, they're your stressors. And a lot of times the schools are not as helpful with accommodations as we would like. We do our best as physicians to provide diagnosis letters for you, but there's only so far we can go. So the IEP and the 504, which I know there was a separate breakout session this morning, but that is something that's really stressful for everyone involved, and sometimes the school just doesn't want to accommodate for you. If you have any other questions regarding the IEP or 504, I was advised to direct you to the arthritis.org website, and they'll have a lot of information for you for resources. But so in this situation, you have struggles with the parent in the medical and the school setting. And one thing that we forget sometimes is the siblings, right? You have a newly diagnosed child, you're very focused on that child, and then a lot of times the siblings get left out, which is why this conference is so wonderful, because they do all of these sessions for the siblings too. So the siblings get that time to experience it for themselves and be able to reflect on their siblings' diagnosis. And I had the absolute pleasure of meeting some of your children yesterday during the doc talks, and they had such great stories. They're all such wonderful historians, and the siblings knew all of their siblings' medications. I was just baffled. One of the little 6-year-old girls I met was telling me all of the dosing of her sister's methotrexate and her meloxicam dosing, and I was just beyond. She knew the name of her sister's rheumatologist. I'm like, this is just a lot for, we sometimes forget about the siblings because, we're so focused on our child with the diagnosis. So I think these are major stressors that we all have to deal with. And then sometimes siblings start acting out in school. So I think this scenario is so common, where we have to worry about how we're going to navigate through the system of a new diagnosis with our child and working on how to manage for the whole family. Oh, we lost you. You muted.
Oh, sorry. I was trying to mute you from my coughing.
Oh, hold on.
Can you hear me now?
Yes, go ahead.
Okay. Talking about siblings, I think this is a topic that is very important. It is to be expected and normal for parents get caught up with all of the medical appointments and medical procedures and things that have to happen at home. And lots of siblings do a really good job at trying to help, doing well in school, but sometimes what can happen is that child can kind of feel like they're being left behind, that they're not being involved. So hearing this little 6-year-old kind of telling you what's going on in their house made me smile, because that is a way to help them feel like they are a part of the family, help them feel, even if it's small tasks, and also even building what we call special time, right? If it's a really busy day, you've had doctor's appointments, you've had conferences, you've had things happening in the home, even spending 5 to 10 minutes only you with the other sibling, playing anything that's very direct, a game that they choose, a conversation that they want to focus on, even if it's 5 or 10 minutes, can go a really long way in still maintaining those bonds and relationships with siblings, as well as with your child who needs a lot more of your attention because of many different reasons. But it is important. There's many different ways to have children involved. If they're really small, that can be adding them in playtime, having special time, having even play dates with them. If they're older, even involving them sometimes and giving them some tasks, they can help them feel like they're being also seen, especially during these difficult times. Now, communication, I think this is helpful for any child, teen, or adult in forms of communicating. Oftentimes, as children get older, with children with medical difficulties, just like juvenile arthritis, there are points in their time where parents are more hands-on than they usually would with an elementary going into middle school age child. However, so that independence is kind of slowed down a little bit. So some of the ways that we can help is helping them make those decisions, whether that's, okay, we need to take your medication. Do you want to do it on your own? Do you need my support? With siblings, that can even be a different way of, we have A and B for dinner. Which do you choose? Giving them 2 tasks, allowing them to make a choice can always help your child feel more independent and a little bit more in control. With a lot of our youth in our medical world, a lot of their control is taken away by doctors and nurses and parents telling them what to do and when to do it. So these are small ways to give them a little bit of that back. Another way to help with that communication is taking a pause when you're talking. If you are talking with your youth, making sure we live in a very busy world. If it's a moment we can put our phone down, turn the TV off, sit at eye level and just listen. And making sure that we are listening, not to respond. Oftentimes we naturally want to problem solve. This is just to listen, hear what they have to say, validate what they're saying, even if it's, I'm in a lot of pain, it's been a horrible day, I have so much homework. That can sounds like this has been a very hard day. You're letting them know you heard them and you're validating what they're feeling. After that, we listen, we validate, and we support. And that can look very different. Sometimes that can just be asking, what can I do for you right now? Can I help you with something? Do you need help problem solving? Then joining in them in that problem solving part of it. But key thing is listening first, validating, and that will allow your teen, especially, to open up a little bit more and communicate, probably in those moments that you feel they're not opening. I don't know what's going on. This can be one small step into doing that.
All right, now we've graduated to middle school. So this kind of correlates to my talk this morning. If any of you were at the AMPS talk, Amplified Musculoskeletal Pain Syndrome. But we have a 12-year-old female diagnosed with JIA at the age of 9, been on treatment with Enbrel and methotrexate, started her menses at 11, and has been complaining of a lot of joint pain in her wrists, knees, and ankles. This has prevented her from being active and exercising. She's had a lot of stressors with bullying at school. And her exam is most notable for joint hypermobility, or as a lot of you know it as EDS, and concern for amplified muscular pain syndrome. No active arthritis. So, just a recap of this morning, this is a very common scenario in the teenage realm, mostly 80% of the time in females, where we have a scenario where they come to the office and they're having pain and not a lot of other arthritis symptoms, meaning morning stiffness, meaning joint swelling, joint effusions, fluid in the joints. And it's hard to differentiate between their arthritis and something else. Now, we have a lot of factors in here that come into play, one being your menses. When you start your periods, the hormones change, your body is changing, you start feeling things that you were not feeling before, and it sometimes can make a chemical imbalance that is very difficult to control. Another issue here is bullying, right? Your kid is bullied in school and it's very stressful. School stressors can be a huge burden on a child and can lead to a lot of chronic pain syndromes. So sort of interpreting at this point, and this is a lot of times the age group that it happens in, where we sometimes have trouble as rheumatologists differentiating between JIA and AMPS, and that's more where that physical exam findings comes in for us. So just give you a little input as to what you kind of need to look for as a parent versus as a physician here, the keys to AMPS versus JIA. But a big issue is psychosocial stressors. So, and this is the time where they're going to see a lot of those start evolving. So that part of that comes in as you come to your rheumatology visit, but as a parent, we want to just kind of open your eyes to new emotions that come in at this age and what is the new norm for this age group.
Most children at this age group will start experiencing a lot of the social stressors that probably weren't as much present or focused in their social situations in their day-to-day in elementary school, and that's normal and to be expected. So thinking back to the first few slides of this is the time where you want to start seeing, are there changes in their mood? Are they being more withdrawn? Are they being more avoidant or nervous or scared? Or even are they experiencing pain at a higher level? We think about that mind and body connection. Social stressors, whether that's anxiety, depression, distress, irritability, impact a lot of the pain experiences in our youth and even adults. If we are feeling more stress, we will experience a lot more distress physically as well. So what is normal? Changes in mood are normal, right? During this time, there's also more social pressures because socially what is happening to youth is they're finding their connections with others via what we know as cliques and groups. They want to make sure they fit in, they are part of the crowd. This is not a time in their social development where standing out is something positive, right? That leads to a lot of anxiety, a lot of distress. And for a lot of kids with AMPS or different medical diagnoses, or they're missing a lot of school, they have a lot of appointments, probably they can't do certain activities. And all of this brings attention, and sometimes that can lead to bullying or feeling left out or feeling misunderstood, or even the stress, a lot of the teens that I work with, and explaining why they can't do these things. Like Natalie Decker had noted, and what we saw in the video, this sometimes can be invisible. Our youth can look physically normal and okay, but are struggling a lot. So this is important times to try to open communication. We all think about communication in teens as kind of oil and water, as this is not something that is probably easy to them. But even just letting your teens know, I'm here to listen, I'm here if you need me, and just letting them know that you are there when they are ready, and checking in and trying to spend time together, even if it's not talking about what that main stressor is, even just quality time can sometimes help open up those moments. When they do come and talk to you about something, those are the important moments to pause, listen, validate, and provide support. Because even if it's something small about stress related to homework, we're letting them know, okay, I can come to mom or dad and they're going to listen and they're going to support me. And those are moments that we're building that trust. So when they are feeling down, then maybe they're feeling more anxiety or depression, they feel comfortable coming to you for those moments. Even if it's something that maybe naturally will upset you or overwhelm you, it's okay to give yourself as a parent a moment. Go to the bathroom, wash your face, calm yourself down, and try to have that conversation in a calm tone, because we don't want to punish your youth coming to you to talk to you about something different. difficult. We want them to know this is safe. And if there needs to be a consequence, that can be done, but in a calm way, because it is important to build that conversation and communication. Now, what is the difference between normal changes in mood and puberty and anxiety or depression where it's becoming overwhelming? It's when it's getting in the way of their functioning, their day-to-day activity, when they can't get to school, when they're leaving school early, when they're no longer doing their activities. When you're noticing, some parents, a lot what I hear is, this isn't my child. They've been very different. That's when maybe we're wanting to have a conversation with your doctor or getting additional support, because it may be more than what naturally comes with puberty. Okay. And also making sure that they're communicating with them on how to identify healthy peer relationships, because those are definitely a lot of the stressors during this time.
And finally, our fourth case scenario. This one really got to me. This is how this whole talk started. I was thinking about a patient of mine recently, an 18-year-old female. She was diagnosed with rheumatoid arthritis about a year ago. She's a senior in high school, and she came to me for persistent arthritis in her wrists. She was on several different medications, and I had been changing her medicines based on changes in symptoms. There were times where she'd be controlled, and there were times where she wasn't. And, you know, she would respond well to medicine initially and then not. And I had seen her at a 3-month follow-up, and she was flaring again. And as an 18-year-old, my mind always goes to noncompliance, which I think as rheumatologists, sometimes you get a little jaded about your teenagers and that maybe they're not taking their medicine the way that you think they are. I have a little naivete, if you will, and I believe that all my patients are telling me the truth until proven otherwise. But a lot of times I find that that trust I have turns into some bad things. So in this situation, my patient's arthritis kept coming back, and I was blaming on the medicines not working or that she wasn't taking it. So I confronted her. I said, look, you're 18 now, right? You're an adult. And as pediatric rheumatologists, we have a really hard time letting go of our patients. I don't know how many of you have 20-something arthritis patients where you're still seeing your pediatric rheumatologist, but we feel that same bond that you do and have trouble letting them go. So for me, as long as you're compliant with your medicines and you still want to see me, I'll see you for a while. But in this situation, it was a hard conversation. We'd talked to the pharmacy, and she hadn't filled her medicine in several months. And we had a sit down with her, and her mother had no idea what was going on. She thought she was taking her medicine. There was a lot of stressors at home, hard to be keeping track of an 18-year-old. And I assumed she just wasn't taking it out of need for control. Like, that's a huge thing in the teenage years, is that's the one thing they can control. Like, I'm gonna pop this pill in my mouth, or I'm not. I'm gonna spit it out, and you're not gonna say anything to me. Or I'm gonna hide it, and you're gonna find it later, and I'm just not taking it, right? So I confronted her about it, and it had nothing to do with control in this situation. Turns out this chronic disease she was facing was causing a lot of depression and suicidal thoughts. And so it became a whole new discussion that we were having, and it really opened my mind to the fact that we really need to dig deeper sometimes into what is going on with our children and what we're missing, and we need to have those difficult conversations. And they are very difficult conversations. The conversation I had with her and her mother was extremely hard, and her mother learned things that she didn't know about her child that had been building up inside. So I think teenagers are tough. All you teenagers out there, give us a run for our money. I was a difficult teenager. You can ask my mom, yeah. So, but sometimes we just have to look deeper into the issue and make sure we're not missing something more serious.
I will say, working with teens is one of my favorite things. They do keep you on your toes. And one of the things that I've learned with teens is when you ask a direct question, they will answer you with a direct answer. And sometimes even that can be scary. Because once we ask a question, we need to be ready for that answer. During these moments, sometimes, yes, I've worked with lots of teens where non-compliance, maybe because they feel, I've heard a lot of, I want to be normal. I want to be like my other friends at school. They don't need to be taking these medications. They don't need to be getting injections. And this is a moment where they've been doing this for many, many years, and it can become overwhelming. Even if we take medical diagnoses off the table, this is a very vulnerable time for most teenagers where we see a lot more anxiety, a lot more depression. Sometimes we have to discuss safety plans and talk about suicide and self-harm. And these are difficult topics, but also topics that we want to make sure that we talk with your youth about, even to just what to do when you're having these feelings. Oftentimes we think about depression, it is this downward spiral where you feel alone and you feel like you're the only person struggling with this. You're the only person who has had these feelings. And a lot of teens and even adults feel like talking to their parent or telling others is a burden. So one thing that can be helpful is taking that burden off of your youth and talking about mental health, normalizing that we all have some of these symptoms in some parts of our lives. Safety risk factors. One, if your youth are struggling with negative thoughts, harmful thoughts, depression, or even a history of self-harm, the first thing that's really important to do is have that conversation in a calm way, letting them know that they are safe. Some safety first things that we do with families is make sure that things are safe in the home. That can be, if your child has a history of self-harm, putting things that they have used or can be used away, locking them up, having a conversation, even to have to do with medication, where maybe as a parent for a while, you take more control of dispensing that medication, helping them during those times while you're seeking that support from a clinician or a therapist. Another important thing is that is a misunderstanding, I think, for most people in our society is we don't need to wait for depression to get very, very big to get support. Your child can just be having a new diagnosis or having a flare and becoming overwhelmed and seek support. That can be brief therapy. We can see counselors with their psychologist. Myself, I work with families 8 to 10 weeks. We're very brief, very focused, and that can often help build coping strategies in the earlier years of youth. What to do with how to calm our bodies, diaphragmatic breathing, muscle relaxation, mindfulness. These are all tools that can be helpful and that we can have children learn in therapy early on. And if it's something that your child, there's somebody in the family that they are comfortable communicating with, that can be with a cousin or an aunt or a grandparent, finding those and helping them. Sometimes it's hard that it's not you yourself, and that's okay. You can work there, especially oftentimes youth and teens are worried to put that burden, like I said, but making sure that they have a supportive environment with especially a supportive team, including their doctors, their OT, their PT, and including mental health, and that if that is what your family needs during these moments.
I would also just like to add that one thing that I know is tough for parents is finding a psychologist. I've been in several different states over the years working and speaking to some of you even today, how difficult and what a struggle it is to find good mental health resources. So I think what's important is not necessarily the title, is that you have somebody that the patient feels comfortable with. Even it could be, I know that Dr. Barreto mentioned youth advisors or religious people. I know a lot of my patients when I was in Texas, they struggled because they came from so far. So they were in these smaller towns and didn't have a lot of resources over there. And just finding a pastor or a reverend or a rabbi or someone in the area or a guidance counselor at school, it doesn't have to be a mental health counselor or psychologist. It's always best to have someone who specializes in pain psychology. I'm very blessed to have Dr. Barreto with me, but there's a lot of people who are not as lucky to have somebody in their community. So don't feel like you can't find someone for your child. It doesn't have to have a title as long as there's a non-judgmental, third party that can really give them that attention that they need.
Yes, and that can be sometimes most schools have a counselor or even a trusted teacher. Other times also, even thankfully because of COVID, there's so many people providing therapy online. It doesn't need to be someone in your community. It could be someone in Jacksonville that can still see you online. Even websites like betterhelp.com, getmanatee.com is one for children and families, but also looking into your community, whether that's your church, a rabbi like Dr. Friedman had said, anybody that is trusted and loved that can be there as that non-judgmental, listening and validating and providing whatever support that your child needs in that moment. Also, I do want to note one of the things that can also be supportive during these times is building structure. Kind of a structured schedule, where especially during the summer, kind of mimicking what happens at school. Oftentimes when we are idle, there's not a lot going on. There's also a lot more time to think and to worry and to stress. So even if that's working with your children to build a summer schedule or a structured schedule during school, where when they come home, they take a break, then they do their homework and they take another break, whatever works for them, then they have their free time, building structures where they can do their work or their chores and they earn free time. Whatever that structure looks for your family can really be helpful when it comes to mental health and stability long-term. So there's small things that you can do in your home with your family and involve your children in identifying what they want to look that to look like. And maybe if we're working on things for them to earn, what that can look like as well. Thinking about that, whenever setting goals, that can be daily goals. Lots of families have things where children have to do certain things to earn their iPad time, or they have certain chores they have to do or homework, while also needing to set goals for their medical and their physical health. That can, a lot of our youth is getting their bodies back to moving, having to do their PT, whatever that goal is. It is important for those goals to be SMART goals. Now, what does that mean? We want a goal to be specific in nature, something that we can measure that is achievable. So let's say if our child right now is in a lot of pain, they're not walking at all. They're kind of in their bed, they're avoiding because any movement causes them pain. Expecting them to walk 10 minutes a day every day is not achievable. They're not there yet. We need to identify what is their baseline. Let's say our goal is to increase their physical activity. Let's say your child's baseline right now is you're walking 3 minutes, 3 times a week. So a specific goal would be, we're going to walk for 4 minutes twice a week, with specific, but we can measure it each time they do it, and where it's achievable. It's a small jump. We want to make small jumps, about 10% in their progress, and be 80% confident that it's something that they can do. So something that's realistic and timely. We want to make sure we can make that, every week, but something that they can check off, because every small goal that they reach, we're building their confidence. If we say, well, you need to walk 5 days a week for 10 minutes, by the second day, they're not going to be able to do it. They're going to feel down. They're going to feel like, I couldn't do it. I'm never going to get better. Versus helping them get a smaller goal can slowly build that confidence, while at the same time building that physical activity and momentum forward. So we can use this SMART goal for anything. That can be completing homework or doing their PT exercises, whatever that is. This is something that can be really helpful to set goals, and not just for your children and teens, but even for yourself as an adult.
Well, thank you very much. We hope this has been enlightening and helpful for you and on your journey with your children, and understanding the importance of mental health in relation to arthritis, because I think a lot of us forget how important this aspect of it is. And when a child asks for help, we should listen, and we should try to do everything we can to help them. I will be available after this to answer any questions, and we thank you so much.
Thank you, everyone.
Thanks again to Dr. Friedman and Dr. Barreto.